I know this wasn't the main event in America's debate over health care reform, but Puerto Ricans live in an unusual limbo status. Created American citizens more than 90 years ago, or some 90 years ago, yet not fully part of the body politic of the United States, especially when it comes to things like the provision of social services. So there's a fairness and equity case on one side, there's a dollars and cents case on the other side. I'm not sure where there's overlap, but what do you do about American citizens, almost 4 million of them, who have some of the same challenges that Americans on the mainland have, but aren't considered part of the current reform? Israel?
Well, I don't know the legal elements with the Commonwealth of Puerto Rico and how that plays into it, but I mean, I would like to see Puerto Ricans be able to choose from more health insurance plans that work best for them. I don't know if there's anything that's hindering them to get more access to the health care plan, but I mean, if they're citizens of this country, I think that they should have the options and the freedom to choose quality health insurance like the rest of us.
At a time when people are watching every dime and the CBO and other government agencies are trying to figure out what these bills would cost, 4 million citizens with lower incomes than the average mainland resident would change the cost profile of any reform that was passed. Michael, what do you think?
Well, I also don't know much about Puerto Rico's situation, but I think that this highlights one of the dangers of relying on government and a promise from the government that it's going to provide you with health care. If you purchase something from a private company, and you have a contract with them, then you can take them to court if they don't hold up their side of the contract, and you'll have the government on your side to help enforce that contract. But if you rely on the government for your medical care and retirement, the government can change the terms of that implicit contract at any time. It, in fact, isn't a contract, and there have been Supreme Court opinions that have said, no, Congress can take away your Social Security benefits, can take away your Medicare benefits whenever it wants to. You have no redress. And that's what a lot of people are concerned about in this health care debate. One of the ways that President Obama wants to pay for all the new government entitlements he wants to create is by cutting payments to doctors and hospitals through the Medicare program, not doctors, but healthcare providers through the Medicare and Medicaid programs. And what Medicare's chief actuary has said is that if President Obama did that, then seniors would have a lot harder time accessing care, and people in the Medicaid program would have a harder time accessing care, which is a lot like the government taking something away from, breaking the promise that it made to seniors that it would provide all this all access to care. And what recourse would seniors have? They couldn't take the government to court. They would have to write letters to their members of Congress in order to get those benefits back. It's another advantage, in addition to all the benefits of innovation and competition that you get if you have a competitive marketplace. Another advantage is it's easier to get people to keep their promises than it is if you're dealing with the government.
Karen Davenport?
Well, I think for Puerto Rico, there are complications in thinking of how the Commonwealth fits into our healthcare system today and a reformed healthcare system, and certainly because it has more of a public health-based and public insurance-based healthcare system than the rest of the United States. So it seems to me that the important thing in thinking of how Puerto Rico is treated in healthcare reform is first that there's a principle that all citizens of the United States are required to have coverage, but also enabled to have coverage, that we have a commitment to that kind of access and equity. And then figuring out what are the different pieces that we need to make sure that that is realized in Puerto Rico. Puerto Rico, I think alone among the territories, all of the territories get a sort of lump sum payment for Medicaid, and I think Puerto Rico alone among them has much higher costs in their Medicaid program than that federal payment is able to cover. And so we already know that that's a special situation that we need to have thoughtful approaches to.
But what about Michael's point that when government is able to be a player in the marketplace in that way, it's a one-sided relationship. Basically, Medicaid provided in Puerto Rico can be dictatorial and say, well, we're not going to do this and we aren't going to do that, and there's nothing you can do about it.
Well, I think if you look at Medicaid law, for example, and the case law around the Medicaid program, you actually see a number of instances where individuals have been able to bring the state to court and to affirm a guarantee to benefits or to coverage that they had been denied by the state. I don't think that it is a completely one-sided relationship, that people do retain rights.
It's a funny situation to be in. I mean, funny in the sense of peculiar, that when we write laws for the other 306 million of us, Puerto Rico sometimes has to be specifically written out because it says citizens of the United States, and you have to put language in that says, well, not in this case Puerto Rico, where everyone, the day they draw their first breath, they're an American citizen. It's an unusual set of circumstances, and one that a low-income part of our population has not gotten a lot of attention. And certainly the specific case of Vieques, you might have the United States Navy on the hook for some of those more environmentally caused diseases. So it remains to be seen, but also it remains to be talked about. And given the lack of patience for an argument where we make sacrifices to cover the uninsured, I'm not sure people living on the mainland are going to be so wild about the idea of taking care of 4 million Puerto Ricans either.